Welcome to the Roche Idea Lab. Please welcome Angie Howard and Angela Baldwin.
Well, good afternoon, and welcome back to the Roche Idea Lab. Our Idea Lab is a community where we can come together to discuss the challenges we face as an industry. And it's a space where we can explore how to partner with each other to solve those challenges. Hello, my name is Angela Baldwin.
And I'm Angie Howard, and we're your hosts for the Roche Idea Lab. I'm the Regional Business Manager with the Molecular Diagnostics franchise supporting the Midwest region.
Thanks, Angie. And I'm a board-certified anatomical pathologist, working as a pathology liaison at Roche since April. Now, we're both really looking forward to hearing the ideas that our guests are bringing to the stage, as well as your thoughts and insights.
So as you're thinking about automation, there may be a variety of questions that come to your mind. How do you know when it's time to make the move to automate your lab systems? What key criteria do you need to determine when and how to make that transition? And how is automation changing workflows and what the future of automation looks like?
These are some of the questions we'll be discussing today with our panel, and we invite you to join in the conversation and share your own perspective. But first, please welcome our moderator, Andrea Bogers, and our panelists, Mark Boehm, Michael Barron, Pearl Albright, and Jim Poppin.
Thank you, everyone. A special welcome to our panel today. I'm going to allow everyone to go ahead and introduce themselves and share a little bit more about what they do in the lab and what their lab is like. So go ahead, Pearl.
Okay. Hi, welcome everyone. I am Pearl Albright. I am the Chemistry and Toxicology Manager at Wisconsin Diagnostic Laboratories in Milwaukee, Wisconsin. I oversee the Roche instrumentation as well as a lot of other ancillary instrumentation in the lab, working to make sure that that automation that we have installed by Roche works for us in a better way so that our technical staff have the ability to do other jobs that we assign them during the day.
Yep, hello, I'm Mike Barron. I am the Executive Director at WDL working with Pearl. So my responsibility is to oversee all the technical areas in the laboratory, and I support those managers to meet the needs of their laboratory. So help them with the decision and establishing the contract and the requirements for obtaining the automation and all the workings that go into it. I've been in the lab for 31 years, so I've seen the lab from the manual world all the way up to the current day we're at with automation. So been a lot of excitement through the years.
Okay. Hi, my name is Mark Boehm. I'm the Lifecycle Leader for Automation within Roche Diagnostics International. So I'm responsible for all the pre- and post-analytic devices that Roche is developing, overseeing the future development and of course the current production, and creating the availability that you can really do automation inside your labs together with the Roche analyzers.
Hi, my name is Jim Poppin. I'm a systems manager for Unity Point Health in Des Moines, Iowa. And my job is to make sure that all of the equipment in the lab can talk and function and behaves in a way that is optimized for our staff and patients.
Well, thank you all. I certainly appreciate the introduction and of course you being here to share more about your laboratory or from a vendor and manufacturing standpoint, what Roche does with automation in this space. So a warm welcome to the panel and also to our audience. Thank you all for being here. Mike, I'm going to go ahead and start with you and just ask, what impact has automation had in your lab today?
Yeah, so we've had automation in our lab for quite some time, but moving up to the A100 actually added to our ability, flexibility within the laboratory when it comes to automation. Just the additional functionality in the processes. I know there's a lot of work that goes into it, so Pearl can speak to the detailed end of it, as well as our pre-clinical manager, Jonathan, who had to put a lot of work with the Roche IT experts to ensure that all the little details were established. Because if you think about the lab and all the detail you have to have with each specimen and each tube and all the specific requirements, tube types, the type of sample, the volume of sample, there's a lot of detail that has to be considered to get it set up. So it's only as good as the people that set it up. So I think that's the biggest factor about it, is getting the right people together and working together in a collaborative effort to get the thing set up the way it works best for you and adds to the efficiency of the lab. Because that's obviously the reason you're bringing in automation, is to improve your efficiency and reduce the amount of errors that occur. But in order to reduce the errors, you have to have it set up properly. Yep.
Well, it sounds like you're instrumental in setting that up in your lab. So thank you for that. And do you have anything to add on the kind of the daily impact that it has on your lab?
Yeah, sure. So we went from, so we were, like Mike said, we were already with automation with Roche, and we had the older MPA module. It was not as fully automated as the 8100 is now that we have in our laboratory. There was still a lot of manual processes with that, including the manual aliquots that we did like on a daily basis. And we're a very large volume laboratory with over 5 million tests a year. So that in turn took a lot of relief off of our staff without having to aliquot all those specimens into other tubes to get put on the line and the ancillary benches that we have. So now we just throw it on the automation line, and it goes through the system, sorts out to itself, where the techs can just come into the 8100, open it up, and take their additional specimens, and then take them over to their bench where it's already prepped, and they can just throw it on the line. So not only does it work for the Roche chemistry line, but it also is a solution for the entire laboratory. And in addition, we also attached our hematology line to that as well. So no more walking back to the lab to the hematology department. So it saves a lot of tests, a lot of technical time. So this automation, as Mike said, it's only good as how you set it up. And it did take us a while after we got it set up to kind of work out all the workflows and everything. But now we're 2 years into it, and I think that it's working extremely well for us, and we're able to explore other instrumentation or other workflows and expand our laboratory even further at this point.
That's fantastic. Thank you, Pearl. Jim, what has your experience been with automation and the impact that it's had in your lab?
We've had quite a journey. So 7 years ago, we transitioned from no automation to the MPA, similar to you guys, and it was eye-opening. We were able to really see a lot of positive effect on not only patient care, but also on our staffing burdens and some of the other more ancillary pieces in terms of analytics. We wanted to try and find a way to measure not only the efficiencies, but also the efficacy of what we were putting in place after we had tried something out. Once we transitioned to the 8100 and Infinity, we were able to expand that significantly. It was just night and day in what we could do with the 8100, with all the different modules incorporated into the 8100. And we realized that we went from a task-oriented day-to-day operations to a workflow-oriented operations, where we weren't necessarily looking at, well, now I got to do a dilution, or now I have to do a rerun. Now it was, how am I going to fit the dilution within the larger workflow so that we can optimize the care of the specimen so that we can take care of our patient better.
Fantastic, thank you. And Jim, I know Pearl mentioned having hematology also attached to their line. Do you have additional
we have Coag
analyzers?
And
Coag and hematology,
yeah.
okay.
Yeah.
Just curious, polling the audience, how many of you either have an automation line today with a third party, or are interested in having an automation line that includes other disciplines like hematology, coagulation, or esoteric testing? I get a raise of hands? A couple of you? Okay, fantastic. That's great. That's one of the advantages to automation, is really thinking about it as automating your full lab.
Yeah.
So Mark Boehm, with that, from a Roche perspective, Roche has been a pioneer in making changes to automation in laboratories. Over the last decade, what are some changes that you've seen in your various automation roles that you wouldn't have thought were possible?
Yeah, thanks for the question. I think what the colleagues here already described is this kind of journey and development. It was not fixed at a time point that you said, now we have the solution, everything is working. I think what was quite significant is how fast the connectivity of all the different functionalities was coming together, how fast we are evolving in the field, and how it really also changed the mindset working inside the lab. As described, moving from these kind of task-orientated setups, really also in these kind of workflow sets. And I think that's very impressive how fast we could go to that point. If I look now from a pure development perspective, I think in the last years, we were always limited in these kind of two-dimensional space where we're always trying how we can squeeze basically these kind of large sets of automation inside the lab, how we can get even more integration. And I think what is really mind-blowing now is this kind of opportunity of vertical transportation that we are looking forward. Of course, now rethinking the lab in 3 dimensions offers completely new opportunities. It gives you more flexibility from a space perspective. You can even rethink your kind of workflows you are doing today, having sample reception at a different level than your normal storage settings and so on. So this is mind-blowing what kind of rethinking possibilities we can create with these kind of modules.
Fantastic. So Jim, I wanted to go ahead and ask you, just bringing automation into the lab in and of itself requires a lot of change.
It does.
What are some of the strategies or best practices that you can share with us that you've had in making changes in automation over time in your lab?
So we've had several rounds of change when we first brought in automation, and then when we built a reference lab and then upgraded the automation with the 8100. What we found is that as you're experiencing rapid growth and change, there's a lot of chaos and there's a lot of information, and knowing how to use that information is critical. You have a vision, and that vision is exactly what you're trying to move towards, but it's easy to have scope creep or deviation from that vision as you're focusing in any particular subset of that. And so having a set of pillars to guide you along that journey is really, really important, because as you're evaluating information, this application versus that application, or resulting here or resulting there, it's very hard to say which would be best. But really the question is, which would be best that supports my vision? And using those pillars to keep you on that straight and narrow path really does help quite a bit when you're experiencing that kind of change.
It's fantastic. Mike or Pearl, do you have anything to add from strategies for implementing automation, things that you would do differently or do the same, make sure that you had as examples for our audience?
Yeah, so for one thing I can tell is that I don't think we knew the breadth of when we were going into the 8100 and moving from the MPA of how much was involved in bringing in this new automation. I mean, we had to coordinate with project managers from facilities, with Roches. I mean, it was a big undertaking and took like a year of planning. And even though during that year of planning, we still came up with new things that were not addressed. So it really is when you have an existing lab space and that's all you have to work with, and somehow you have to move every piece of instrument around there now to fit this big automation line that's going to support your entire lab. In the end result, we all know it's going to be great, but getting to that point is a little bit painful. I'm not even going to lie about that. We had staff displaced for months on end, and people running from one side of the lab over to the other side of the lab to keep all the other instruments running. So it definitely is, putting in automation is kind of a task in itself, and it really requires a lot of coordination. But once all is said and done, it's really, the reward is great.
Yep. One thing we did in the process is we got what I call volunteers that were change agents. So people that were more adept to changing or more willing to take on the change, and getting them as kind of a crew of folks to help get the people on board with the change. Because it was, like Pearl mentioned, there's a lot of disruption in the laboratory moving. We ended up remodeling the lab. We had 10 different phases that we had to organize the lab and figure out where we're going to move the instruments temporarily and allow the testing to continue. So one of our claim to fame is that we did not affect testing turnaround time the entire time that we did this remodeling to fit in the larger automation system, even though we had some significant disruption. A lot of that was put extra effort by the staff, but creating that change agent and the support for changing and understanding what the end goal was, I think that helped motivate people. So you got to take that human factor involved with that. Besides all the other things with change, we had to redo our electrical infrastructure in the department. Airflow was another big factor. A larger instrument brings more heat. Something to think about. We had to redo our water system because our water system previously wasn't able to support it necessarily. So some of the things you need to think about, might be additional costs. So the cost was a little bit more than what we initially expected, but I think it was well worth the effort. But identifying that, early on and part of our process and change management really helped us get it through successfully.
Fantastic. So what I heard based on that conversation was really establish your vision and be forward thinking. Plan for the unexpected, right? There are going to be things along the way that are rocky, and to really find change agents, people that can help the staff through those troubling times to get to that end goal and vision. So thank you all for that. It's appreciated. Speaking of vision, Mark, I'd love for you to give the audience a little peek behind the curtain and share a little bit about Roche's vision for automation.
Yeah, perhaps let's start also with a comment what the colleagues were just describing. I think what is the most important vision from my perspective, if we are talking about transforming the way how a lab has to operate, I think that is the most challenging task for the whole personnel to go to that point. And from my perspective, that's one of the major parts when we're looking from a customer-centric development perspective. How can we facilitate these kind of transformational processes with our products to the best extent? And I think that's really the point where we are now also trying to optimize our product development, that these kind of deployment sets, having future-proofed, upgradable systems so that you can really build upon the things you already achieved in the lab, is a very important piece. I think this is really that we have these kind of upwards compatibility, not only on the hardware side, but also talking about software. I think that's the most important piece, so that we can generate a workflow setup that will also be able to grow with the lab in the future and adapting towards that. So that's one part. But looking a little bit further on, I think there are two things Roche itself is now striving to realize in the long run from a vision perspective. I think the one part is this kind of vision of a dark lab. And this is really spelled literally, that you have a lab that is operational without that you have to turn on the light, because you need human interaction. I think that is really the point, reduce the amount of human labor to the point where it really can create value about the medical knowledge of the people, so that you can really improve the level of the results that are given to the patient and of course to the clinician. That's one part. The other part is looking at the full ecosystem and see the kind of broad menu we are offering also from a different solution perspective. We also have to think about how we can create also a more open ecosystem to serve also the needs of the customers, so that we can really create integration also beyond the current Roche products. And I think these kind of elements are very important, so that we can make it future-proof, open, and tackle the challenges from a workforce perspective, so that we can also enable the labs of the future to operate seamlessly and really transforming their way how they can serve their patients and their clinicians.
Thank you for that. That's a nice little sneak peek, and I think with staffing pressures and everything going on in the marketplace today, our labs would be very appreciative of less touching of anything. And I think you already achieved that a little bit with our automation lines, but anything that we can do to assist with that is impactful. So that's great. Speaking of impactful, Pearl, we've talked a little bit about how Cobas Infinity has empowered your lab and really led to increased efficiencies. Can you share a little bit more for the studio audience about that?
Yeah, so Infinity, for those of you who don't know, it's kind of like the brain of the automation, where it kind of directs samples to go where, what to do with these rules by rules written by us. So let's say we want an automatic dilution done on a specific assay. We write that rule, it automatically does it. There's no technical staff involved where they have to remove it, perform that dilution, and put it back on. We have validated, extensive dilutions to go even beyond of what some of our assays currently are done by the manufacturer, just to validate them and program them into there as well. So it really does, it helps out with add-ons. So if, say like you wanted an add-on, the doctor would put in the order and you would just plug it in the computer and they would know right away to go to one of the output buffers that we have or into the storage system, retrieve that specimen, and if it's within a certain amount of time, it'll put it right back on the analyzers without any technical intervention. Or if it had been in the refrigerator for a while already, let's say 1 or 2 days, it'll bring it out so that it'll warm up well enough, and then the staff just have to take and put it on the other side, and it'll go right back through and go to whichever instrument line that is best able to perform that. So with the automation, you can program your analytes either duplicate or triplicate, so you are always up and running. TAT is not decreased at all whatsoever. Matter of fact, it's like pretty much improved across the board because the instrument knows where to send it, what module is less busy. So it's really optimal performance, and a lot of times we don't even know that patient was even on the line because it went through, got resulted out, and it's automatically gone across with auto verification. Then the whole system itself will store it in the refrigerator where it will sit there until it's due to its disposal date. So Infinity is really like relieved technical staff on time. I would say that the most of the time that technical staff spend on the line right now is really doing the maintenance part of it in the morning. So other than that, samples pretty much are not touched too much anymore.
Wow. What an achievement. That's what everyone wants, right? Not to have to spend that staff time really fussing with your samples, so to speak, or babysitting your lines.
Correct.
With that, how has your staff been able to use that additional time? How has it shifted their workload in the laboratory?
Yeah, great question. So along with the automation, we also have a lot of ancillary benches. And I'll know due to the staffing, we've gotten limited more people on these ancillary benches. So it's really, from a staffing standpoint and scheduling, it's really kind of been a struggle lately. But with those, with the automation, able to free up some technical staff time, we're able to get a little bit more training done while we're still training new staff and get additional staff trained on other benches that they've been there, so we can move them over there when they need to be. If it so happens that a technical staff calls in and we're down, we normally have 3 people running our Roche automation line. Let's say we can run on 2 people. All we gotta do is mask one of the lines, have one person doing the maintenance, and the other person is watching all the samples going through and making sure they're going across the interface. So it can be adjusted to on a day-to-day basis on our staffing load on how we can work through the lab and get all those results out to the physician still in a timely manner.
That's fantastic. It sounds like you've been able to find a great level of flexibility with your Roche solutions. So
absolutely.
That's great. Jim, when we talk about the future, you were talking about your vision for the laboratory. I'd love to understand if you could go back in time and tell your future self what you'd need in your lab today. Is there anything that you'd do differently or that you'd change?
Yeah, we ask for more time. It's always the issue, isn't it? The amount of information that you're going to have to take in order to make good decisions is considerable. And that's going to be true anytime you switch systems, whether we're talking about hematology or Coag, but when it comes to automation, it's an order of magnitude greater. And I think I would go back and tell myself, hey, I need to talk to Roche more. I need to understand more. I need to be able to speak the language. When we start talking about modules, AOB, or workflows, or automation versus analytics, I have to be able to understand what that means, not from my perspective, but from what we're getting perspective, from a Roche perspective. We have to be able to speak the same language. And so really planning ahead in that vision so that I can have the tighter, closer relationship with the people who can give me the information I need from Roche, that's what I would do.
Perfect. Thank you. That's great. Mark, for you, I would like for you to share a little bit. I heard you say, thinking about the customers as Roche develops their products and vision for the future. What is Roche's approach to how they work through new generations of automation and what they think about bringing to market?
So I think it comes back to the point that Jim was mentioning. So thanks for the segue. So in the end, talking with each other, even more than we have done in the past, I think is a key to success. When looking in this kind of setups, basically in our environment within Roche, we have very standardized development processes, which of course involves customer requirements right from the beginning. but I think we have to be a little bit more bold. So I think there is a huge appetite also from the customer side, and please chime in if you think differently, but having this kind of exploratory pathways early on before we start going into product development. So really working around this kind of prototyping setups, trying to experiment and learn and building things. And also if we have failures, we can learn out of this as well. So just being a little bit more brave and trying to experiment more, learn, and then if we have a good idea what is the optimal pathway, we will be much faster in delivering to the market than we have been before. So I think that's really the point, talking about this customer-centric view, and then also moving away from this pure technicalities. As we were starting to talk in the beginning, I think what matters most is thinking about what are patient individual workflows that we have to bring into the market in order to serve our patients in the way they need to get fast treatments, fast therapy decisions, and so on. And this is for me very important, that we try to always have this technical layer as a foundation, but try to think how we can make these kind of patient individual workflows work over time. And I think that's really an exciting opportunity, because it creates a complete different way how we can interact, how we can talk to each other. Of course, it really gives you the direct impact of the outcome we can achieve if we transform the way how we do automation today. And I'm quite curious if we can make this kind of very bold vision now in the next 5 to 6 years. So if we would meet you again here in Chicago or in Anaheim or anywhere else. So what will happen with these kind of visions and how we can work together in order to achieve that. So quite excited about the new ways how we can collaborate.
I personally love that. I think that's a great approach from a manufacturer perspective, from a vendor perspective. I am curious for the audience, if you were able to be a beta site or to work directly with a manufacturer to improve products, how many of you would raise your hands and say, sign my lab up? I see a couple. Good, good. It's extra work. I'm not saying that there's nothing there that you'd have to do, but I do think that working together makes everybody stronger and makes it really about the patients and getting those patients' results more quickly and getting them better results. So those are all important things. Mike, we haven't talked to you in a minute.
Yeah.
What do you foresee from a trends perspective in the automation or the laboratory space?
Right, yeah, it's something I think about all the time and where we're going in the laboratory. Because when you first started in the lab, the old school, you had your workbench and very inflexible, and you had to work around with the workbench and the space that you had. It was permanently fixed to the floor. You had electricals plugged into the middle. What we were able to do with this automation, and something to think about, is we worked with designers. We had a lot of different project managers from IT, facilities, airflow, the whole 9 yards, to kind of create a space that you could work best with. So we basically cleared the slate, moved all that permanent structure out, and moved in tables and rolling counters, even height adjustable counters, to allow you that flexibility. Another part of that is to have, you think your electrical and data, you need to have some flexibility around that. So you don't need that permanent structure for that stuff. You can bring it from the ceiling or the floor, depending on how your lab's designed, and have that complete flexibility about future use. So that's one of the biggest challenges we had in our lab, is we had limited space. We still have limited space, but making best use of the space and how you can work forward with it. Because I know all hospitals don't only have so much room, and if you're working in your lab, you have to figure out how to fit it in. And we did work with the Roche folks as well to help us figure out how to best place the instrument, how to strategically place the front end, the outputs, and how to move the specimen throughout the lab that could get the most efficient approach, which I look to as this automation gives you that ability to increase your capacity in the laboratory as well, because you need less staff. And when you get the large automation and moving things through efficiently, instruments don't get tired like people do, So, I think we have at least 40 to 50% of extra capacity on our line. We could probably fill that extra capacity with a very minimal impact on staffing.
I would agree.
So, that's something else to look for in the future, because then you have that future growth. Because if you ever think about it, whenever you design a lab, you think, oh, this thing is huge, I don't have any place. I got more room than I know what to do with. Within about 2 years, you're cram jammed in there, don't know where to put things. So, start right, start it out open, and then create that flexibility of the space, and then look at your capacity, your limitations from there.
So an open footprint, I can see where you might be interested in utilizing that vertical space in a,
we saw that.
In a limited footprint, so lots of potential.
That could move samples to a different part of the laboratory you didn't think possible, because I think that was part of our limitation. If we had that, currently we could move it into different parts of the laboratory, so that new solution there will really help out with that as well. So.
Yeah, there are lots of new exciting things coming in the automation world, so that's fantastic. I want to take a minute just to see if the audience has any questions before we continue.
When you attached your hematology line to your automation, was there an impact to your turnaround times?
You go ahead.
Well, in our situation, initially we had hematology on the front of our line, or we actually moved it manually. Now it's at the end of the line. So from a overall turnaround perspective, it went up a bit. But now with automation, one thing you get is more consistency with results. You don't have a sample sitting here or there. So I think the turnaround time is a little bit longer, but it's more consistent. So if you want to look at it that way.
And I'll just add to that. I think if we could redo things over, I think we would have kept the hematology at the front of the line, so we could have just load those samples up, and those tubes would then be out of the way because they would be on the hematology analyzers, and then the chemistries would be able to circulate through more efficiently. The increase in turnaround time is just because of the path that it has to travel to get back there, but that certainly is a configuration part. It has nothing to do with actually the automation line itself.
So that's something you really want to think about when you're doing it, is try to get those, like Coag. You want to have Coag up front, the hematology up front. Chemistry, you could probably wait a few extra minutes. So see if you can design your lab accordingly. But our limitation was our tube drops were here, and trying to figure out how to put it with the pillars into place. So that always adds to some of the challenges. So even if you had open footprint, you still have support beams that can get in your way.
Definitely, especially working in an existing lab space.
Right.
It's always a challenge. Jim, you've added both Coag and hematology to your line. Have you had a similar experience, or is your experience different?
Well, fortunately for us, we didn't have space issues, thankfully. But what we found is that for normal CBCs, turnaround time is a turnaround time, right? I mean, it's really going to be what you do on getting the specimen to the analyzer that's going to affect your turnaround time. And being able to place that on a universal, hey, start here spot, where there isn't as much walking, there isn't as much confusion, there isn't, hey, I got this specimen has both an A1C and a CBC ordered, now I need to do something different. When we remove all of those conditions and those variables, and you just say, put it on the input buffer, which is where you put specimens on the 8100, it equalizes your turnaround time on the front end. On the back end, when you start talking about CBCs that are not normal, that don't auto-verify, now you're going to start seeing increases in efficiencies, decreasing your turnaround time. And a lot of that has to do with the fact that, when we transport that specimen to the RFX, which is going to be attached to your Sysmex line, or I'm assuming it's going to be Sysmex line, for example, it says, hey, I know where that is. Your tech knows that, hey, it's now on the system, and they can go ahead and either pull up whatever application they are for monitoring results. It pops up, and they know immediately if it's going to go for television or if it needs a manual diff or anything like that. So you don't have a tech standing in front of the instrument. That's a time waster, really. I mean, because the primary purpose of a tech is to get results out the door. That's it. Secondary purposes, sure, they got a ton of those. But really, from a patient perspective, which what we're trying to do, we want results out the door as fast as possible. Getting them in front of the application, in front of that resulting workstation, rather than in front of the instrument, that's the goal. And that's what we can do when we have automation like this.
And so with our A1Cs, we have it interconnected within our CBC line.
Yep.
So hematology and A1C are all together. So we don't have that complexity of moving it from one place to another. It's free flow. So something to think about if you combine that purple top, the CBC with the A1C, you gain efficiency that way.
Yep, absolutely.
Yep.
And we have workflow right now that ensures that a CBC and the differential never be pending before we go and sample the specimen for an A1C. That's a safety measure, right? And so when we put that in place, now all of a sudden the tech doesn't have to worry about, well, I need to go check and see when this is done. No, we know when it's done. Now we can just go ahead and pass it on for A1C testing. Does that answer your question? Perfect.
Fantastic. Are there any other questions from the audience that you'd like to ask the panel right now? Okay. I would like to wrap up the automation panel by both thanking Mark Boehm, our life cycle leader from Roche, and all of our panelists. We appreciate you coming in and being here and answering questions around automation and what you see coming into the future. So thank you all for your participation.
Thanks, Andrea.
Yeah, thank you.
Many thanks to Andrea, Mark, Michael, Pearl, and Jim. What a great dialogue around automation and the value that it can really bring to the laboratory.
Yes, it was. And well, that wraps up our last session in the Ideal Lab. But we hope you're inspired to continue the conversation with us at Roche and amongst each other. Collaboration is key to sustainable innovation, and partnership is what will pave the way to the future of healthcare.
Angela, what a robust dialogue we've had these last 2 days around health equity and how we can close that gap by having inclusivity when it comes to clinical trials. We've been innovative, talking about how we can reduce staffing shortages and how automation can really bring value to the laboratory. We've also talked about IT and workflow conversations. Let's keep that going. I'm looking forward to seeing all of you at the Roche booth and at future Roche labs to come.
Let's keep the conversation going. Thank you all.
Take care.